Welcome to Lesson 3 on Patient Opinion. In this lesson, we will continue to leave our story on the Patient Opinion website. The story has been left on the website by a friend. Underneath "What is your story about?" it says Orchid Ward. Under there, it will say "What happened?" If you click on here, you will see that it lights up a box in blue, and that's just ready for you to type into. You can type directly into here, but if you prefer, you can type out your story in a Word document and then copy and paste it into this box. In this case, this is what I've done. So I'm pasting it in the box, and that has filled the box with text. When you've done that, what it will ask you to do next is ask you who you are. You will go to the menu on the right hand side and select one of the options. In this case, it's a friend. The next step is to just click on the pink box, and then that opens up a new box. So, what is your friend's postcode? In this case, I'm going to put my work postcode because I don't know what their postcode is. NG36AA. This is important because it helps Patient Opinion to get the stories to the right area and the right services. It will also ask what conditions, tests or treatments are in the story. If it's not clear that there's tests or treatments, leave it blank, but if there is any, what you can do is add them. If you're not sure what that means, there's always a help box to guide you. The next step. When this opens up, it will ask you to select any services you used or add another to the list. It's very important to add Nottinghamshire Healthcare Foundation Trust. This will pop up in the box. Click on it and you'll see that it's already got a tick next to it. It's very important you do this because if you don't, it will just go on to Patient Opinion and it won't be tagged to our service. You may also want to put Millbrook. And what this will do is give you lots of options, but it's important that you pick the right one. And that's Millbrook Mental Health Unit in this case. So anything you can add to actually get it to the right service is really important, and it helps us to get it to the right team. When did your story happen? Just click on the drop-down menu box and it will give you options. In this case, I'm just going to click last week. Then the next step. Add some keywords to say what was good, what could be improved, and how did you feel. This is optional, but it does actually help to build up a picture of Nottinghamshire Healthcare Trust so that we can see what people are thinking about our services. And in this case, the friend thought the staff were good. So in this case, you could click staff. What could be improved? Nothing was mentioned in that story about improvements, so you can leave that blank. And it may ask you how you feel. It was mentioned in the posting that the staff were kind, so you could put kindness and click there. You can put as many tags in there as you would like to, but it is optional. So the next step. You do have to sign your story to confirm it's true. And if it's a new user, and this is the lesson to help staff help new users to post their stories on Patient Opinion, it will ask if you've got a password. It will also tell people that they can't publish this story until they actually have an email address, and you've got to be happy with the terms. So that's why you do have to sign the story. So in this case, it will say, do you have a password already? And in this case, it will be no. Your email address, which is confidential, you would ask the person to give you their email address. Your screen name, that means a nickname. So something that is a recognized name for you. And that's the name that will appear on the website when the story is published box, because Patient Opinion don't leave lots of emails in your inbox, and the ones they do are quite helpful. And then if you want to, you can click on the terms of use to explain what we will do with your story now. So I'm going to click on there just to show you, and that will pull up a page that explains the terms. terms and conditions. So it's important that people know it's there, just so that people are clear. And what you can do there is to accept terms and sign the story. Now, if I click on there now, it won't advance because I haven't put in all of the details. But when I complete that, it will submit the story, and then that will go to patient opinion, and that's an office based in Sheffield. They will read your story, they will moderate it and publish it. Occasionally stories are not published, and if not, patient opinion would email you to explain why. And that ends lesson 3, and I hope you've enjoyed finding out about how to tell your story on patient opinion.